morning, everyone, and welcome to today's Regional COVID-19 Virtual Open Forum. So just as some quick reminders, our next call will be on October 22nd, and we will be posting an evaluation in the chat. So please let us know how we're doing so we can improve our future calls. I'll be posting that right now. To get us started, I just want to go into what Superior Health Quality Alliance is. We're hosting this call today. We were formed in 2018 with 8 healthcare organizations across 6 states. We are working to achieve broad national CMS quality strategy aims, and our goal is to collaboratively improve the quality of health and healthcare for the consumers, patients, clinicians, organizations, and communities we serve. We have 2 high priority areas that align with CMS, and those are nursing home and community coalitions. And so we will be working with both of these groups over the next 4 or so years to improve healthcare. We'll be doing that through 3 different strategies. The first is independent implementation. The second is affinity groups, and the third is structured collaborative. And these are kind of on a continuum. So the independent implementation group will be more self-guided. And then once you go over to those structured collaboratives, that's where you'll be receiving the most amount of technical assistance from someone on our team. We'll be focused on 5 strategic goals through these 3 strategies, including increasing quality of care transitions, increasing patient safety, increasing chronic disease prevention and self-care, improving nursing home quality, and improving behavioral health outcomes, including opioid misuse. We would love for you to join us, and I will be posting a link in the chat for that, and you'll see that in just a second. And you'd be able to click on that link and fill out a form to join us. All of this work and all of our technical assistance is free to whomever signs up to join us, and that will be rolling out sometime in November. With that, we will begin our presentation shortly. We just want to remind everyone to please mute yourself when you are not speaking, and remember to unmute yourself and state your name, state, and organization when participating. If you are participating by phone, you can press *6 to unmute yourself. Please remember not to disclose any personal health information if you do add anything to the chat or unmute yourself by phone. If you are having any trouble with Zoom during the presentation today, please message me in the chat box. And if you have any other questions or comments, please chat them to everyone. And just as a reminder, today's call is being recorded. So with that, I will hand it over to Mia Croyle.
Thank you, Elena. And there were a few questions in the chat box about whether the slides will be made available. So I don't know if you want to address that before I get started. It sounds like that's a concern for some folk.
Yeah, definitely. We can send out the slides in our next email that we send. We'll make sure that there is a link to these slides available. Thank you.
Okay, great. So I work with the behavioral health team, working on some of our goals around behavioral health. And I am going to talk with you a little bit today about some of the behavioral health impacts that we've seen during COVID over the past 6 months. So we see that both the effects directly of the COVID-19 pandemic and then the effects of some of the measures that we've been taking to try and contain this have placed a significant burden on the mental health and mental well-being of people across our country. And as we think about, you know, what people are concerned about, right? So in surveys, people generally report, you know, that they're anxious and have a lot of fears about themselves and their loved ones getting ill. There also have been challenges and changes to the ways that we access our healthcare. A lot of healthcare has shifted to telehealth. A little less so now, but a lot of routine care was postponed, especially in the beginning. And so just, you know, changes and challenges to how we would normally go about accessing both our healthcare and our mental health care systems. People are very concerned, and lots of people have experienced changes in their employment. and financial impacts as a result of changes to the way businesses are operating. And then we also see that a lot of the things that typically people would use as rest and restoration to restore themselves during this time have been either canceled, postponed, curtailed. So dining out, traveling, sports, concerts, just family gatherings, all of those things. So we've seen impacts in a large number of areas. And as a result, we're seeing some effects. Next slide. So when we think about how these things and this state of crisis has impacted us as people, just as human beings, we find that a lot of people are just walking around on a daily basis in that constant state of, high alert. We tend to think of that as our fight, flight, or freeze mechanisms in our brain and our body. And so people just are sort of walking around in that state of needing to be in that high alert self-protection mode. What happens to our body when we're in that mode is that we just get flooded with adrenaline, cortisol, as well as other hormones and neurotransmitters. The way our bodies are designed, that's great in the short term, right? That's what helps us survive crisis. That's what gives us what we've called our sort of human surge capacity. That's those adaptive systems that allow us to, cope in crisis. We draw from that and we can survive through acutely stressful situations. However, what we see is that over extended periods of time, high levels of those adrenaline, cortisol, the neurotransmitters in our system, our capacity will be exhausted. And exhausted is a great word because I hear a lot of people talking about just feeling flat out exhausted. So that surge capacity runs out. It's not infinite. And so what happens in times of sustained crisis is that our bodies and our systems just get so depleted. We have to find a way to replenish. Next slide. So we hear often this phrase social isolation, and really it's paired with this idea of social distancing, right? So we've been told that one of our mitigation strategies is to be socially, to do social distancing. And in fact, quite a few people have said, I think the physician who initially proposed the term social distancing has now said, gosh, I really wish I had named it something different, because really what we're talking about is physical distancing. And our task in this time is to find ways to keep and maintain our social connection while we're being physically distant from other people. We find that there are a lot of, unique strategies that people have found. We think about what things we heard about early in the pandemic. There are the stories out of Italy of people singing from their balconies, right? And that's a way that people were physically distanced, but trying to get that social connection. In our area of the country, I'm located in Wisconsin, and there was a big sort of push for people to decorate the windows of their houses with hearts. And that was another way just to try to establish a bit of that social connection while still, we were staying very social, very physically distant. We also know that we're masked up all the time. Even from behind a mask, eye contact is important. Waving when we see people, moving our facial features, saying hello, all of those things give the parts of our brain, which tends to be our vagus nerve, our mirror neurons, the parts of our brain that really stimulate that social connection and that engagement. Friendly voice, raising our eyebrows. So all of that stuff really does have an impact because it stimulates that social engagement system and it gets that part of our brain online and working. Next slide. So I just want to give you a little sense of the statistics that we're seeing coming out. I don't want to, this could be a very dry and boring long lecture about the statistics, but really there's been a couple key reports that have come out that give us the impression that we really are starting to see what some people are calling a parallel pandemic. So this pandemic of mental health that is running alongside our COVID-19 pandemic. So the CDC did a report where they surveyed people just in the last week of June, so in 1 week, and looking particularly at depression and anxiety rates. And they found that for both, the depression and anxiety rates were quite a bit higher than they were in the same quarter. So it wasn't exactly comparing 1 week survey to 1 week survey, but they looked at the data from the second quarter of 2019 and compared it to the survey data from that 1 week in June. And they found that the prevalence data for anxiety symptoms in 2020 was at about 25%. And in 2019, for that second quarter, the same symptoms were at a rate of about 8% of the population. And when we look at the depression prevalence, it was about 4 times that. So in 2019, the reported depression rates were about 6 to 7%. And in 2020, we were again right at close to 25%. So if we think about that and there's a good deal of overlap. So people who reported anxiety also reported depression, but there were unique cases as well. So if we think about that swath of the population, at least a quarter of people are walking around with significant symptoms of anxiety and depression on any given day. Go ahead, Elena. So here's a little more of the full report out from that same survey. So about 40% actually they found when they fold in substance use as well. So about 40% of US adults reported either depression or anxiety symptoms, having some trauma or stress-related disorder symptoms, so some PTSD or other trauma-related symptoms. We also saw that about 13% reported that they either started or increased substance use, and a little bit over 10% reported that they had seriously considered suicide. Next slide. Mental Health America also has been doing some consistent screening throughout this pandemic. They have a long-standing online screening survey that's been in place since, I believe, 2014. And so they've been looking month to month, and May is the most recent month that they have data available. And they reported that as a result of their screens, they're finding that about 88,000 additional people have reported developing anxiety or depression directly as a result, not just simultaneously to the COVID-19 pandemic, but tying that directly to the pandemic. And they found that in the month of May, more than 21,000 of the people who took the depression screener also reported thoughts of suicide or thoughts of self-harm on more than half the days. So they're saying, during this past month, more than half of the time I've had suicidal or self-harm thoughts. To put that number in perspective, about 45 to 50,000 Americans die by suicide annually. So nearly half that number reported having suicidal thinking in just the month of May. Next slide. So one of the strategies that has been proposed to help us get a handle on this, these significant mental health impacts, is to do some screening. So just in general, in our healthcare setting, these are the conditions that we tend to look for when we think about, is it worth screening for something? Is a condition something we should be doing screening for in general? So is it an important health problem? Is there an earlier stage where there are symptoms and it's easier to intervene at that earlier stage? Is there a test that's easy to perform and accurate, reliable, sensitive, specific, all that good stuff? Is there an acceptable treatment? And is the diagnosis and treatment cost effective? Go ahead. So when we look at depression, anxiety, and even loneliness, we find that those are all true for, we meet all the conditions of things that we could screen for. This is the brief version of the UCLA loneliness scale. There is a full version as well, but this is a brief version that you could think about offering to those you serve, just to get a sense of how socially connected they're feeling at any given time. So it's just 3 questions, easy to score, gives you a sense of, and even just at face value, you know, you're looking at that, you can tell if they're saying often, 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 or some of the time and oftens, you know, you've got a sense that that is a person who's really struggling with feeling connected to other people. Go ahead to the next slide. And then a lot of you are probably familiar with the PHQ-2, which is a depression screener, the PHQ-9. This is a PHQ-4, which combines 2 questions on anxiety and 2 questions on depression. So given that anxiety rates are some of our leading signals in this particular pandemic of some mental distress, it might make sense. If you already have practices in place to do the PHQ-2, you might think about just doing the PHQ-2 and then asking a question about anxiety. But if you're not already having processes in place to do any sort of screening, you might think about these brief 4 questions that just ask over the past 2 weeks. How have you been feeling? Have you been feeling nervous, anxious, or on edge? Not being able to stop or control your worrying, having little interest or pleasure in doing things, feeling down, depressed, or hopeless. And again, people can respond by saying, you know, not at all, oh, some days, more than half of the days, or nearly every day. And there is a longer version of the depression, which is the PHQ-9, and then there's a longer version of the anxiety screener, which is the GAD-7, the Generalized Anxiety Distress, and it's 7 questions. So if you wanted to follow up with some positive findings on this brief screen, you could always administer the full longer screen. Next slide. So as we think about, okay, so screening is one thing, what are some other system level strategies that we should be thinking about if we truly are starting to see a parallel pandemic of mental health concerns coming out of this, right? So we obviously want to increase our screening efforts, enhance those for early detection, and you know, screening is not necessarily something that has to happen just at a primary care office. Anywhere that we touch people, we could think about encouraging them to screen. The one caveat is that you don't want to screen without having something in place for follow-up, because you will identify people who are really in need at that point. It may be as simple as a referral or a list of referral sources, but you need to have something in place to respond when you get screens that indicate that there is a concern. We also want to think about how can we continue to focus on continuity of care. So are they in therapy? Are they in behavioral health services? How do we continue that? What about medication? How do we make sure that there aren't disruptions to people's medications because of the changes in access to care? What barriers can we reduce or eliminate to accessing behavioral health care? Are there ways that we can get rid of financial barriers? And are there physical barriers? How do we need to help people who may not be ready or used to or very accustomed to using technology? How can we help them access a lot of our behavioral health services, which now are being delivered via telehealth? And then, you know, this is a larger strategy, but I think it's important to always keep in mind that we want to combat the stigma associated with seeking help in whatever ways we can. So, whether that is talking about your own help seeking or finding ways to highlight ways that other people have sought help and benefited from it. And just having conversations with people can help normalize the idea that this is something that we can seek help with, just like any other health concern. And then promoting wellness, overall mental health wellness as a prevention strategy. Go ahead, Elena. So those are system level strategies. What can we do on an individual basis? If we have someone in front of us, whether it's a patient, a resident, a staff member who we're working with, who seems to be struggling, experiencing a great deal of distress, what can we do? So one is to validate and normalize that distress. Really, one of the most helpful messages we can send to people who are really struggling is that these are highly abnormal circumstances, and it is a normal and human reaction to be struggling in this time. It's a normal and human thing to be worried. It's a normal and human thing to feel sad and to really be experiencing some grief and loss over the changes in our world that we've seen as a result of this. So helping people understand, they're not, bonkers because they're feeling this way. It's normal and expected to feel this way. These are abnormal times. And then finding ways to help people reduce feelings of loneliness. There are online support groups. How can we set up regular calls or video chats with people who are supportive? And what types of safe interactions can we establish? I talked a little bit about already, singing from the balconies in Italy and putting hearts in our windows. What other things can we do? I mean, those are two just beautiful, creative responses to connection. What else can we establish? And then encouraging the person to seek mental health treatment and to think about, although we've never been through a time like this before, everyone has been through some stressful times, some hardship in their life in the past, and thinking about what has helped them cope with that could be useful. So then how can they carry that forward into this? How can they use that strength, use that experience to help them develop some resilience in our current situation as well? Go ahead to the next slide. And I've put in the slides a few mental health resources. And the first one is the Depression and Bipolar Support Alliance. They have a wealth of resources on their webpage. They have podcasts, groups that you can join, written materials, lots of different multimodal kinds of resources there. The next one is just a link to help you find local mental health resources if that's something you need, or if you need to look at some resources, you're looking at developing a resource sheet or something like that. And then the VA also has some really great resources listed for how to manage the stress associated with COVID-19 specifically. Can you go to the next slide? And then these are numbers, one back. These are numbers that I think we should be posting and publishing everywhere often. These are our crisis resources. So we are seeing an increase in suicide rates, and we want to just make sure that we get crisis information available as widely as possible. So the National Suicide Prevention Lifeline, there's a disaster distress helpline that is prepared to talk to people in this time. And there's either a phone hotline if people would prefer, or for some people who would prefer texting, there's text options, both with the disaster distress helpline or the crisis text line. And there is a specific line for support in Spanish, although both the disaster distress helpline and the National Suicide Prevention Helpline also have Spanish and other language resources. They just involve usually getting an interpreter on the line. So that's what I had prepared. I know we don't have a ton of time, but I would love to hear from you guys, either in the chat or feel free to unmute yourself and share. What are you seeing in your settings, both with employees, with patients, residents, and what strategies have you used or seen used to help try and establish connection or try to promote mental wellness?
Thanks, Mia. Again, if you do want to speak up by phone and you're joined by phone, you can press *6 on your keypad and that will unmute your line. You can always add things into the chat, or if you're joined via the Zoom platform and using your computer's audio, you can click the unmute button when you hover over your name.
So Elena, I'll make a quick comment. Thank you, Mia. This has been really interesting and helpful, quite comprehensive. I have sort of a recommendation for everyone, and this in itself, because we record this, you could take this back to your HR departments in your organization. This would actually work very well regardless of your type of organization as far as the work that comes out of your organization. So just a suggestion that you might want to consider having supervisors, managers, staff listen to this short presentation that would give a lot of resources to you and save you some time.
This is Justina from Town Home Health. Actually, this is a great suggestion. I was thinking if it's going to be recorded or it's just the slides that are going to be sent to us. It is a great presentation. Thank you so much, Mia. I was thinking about including it for our orientation when we do like a general orientation for all the clinicians, including skilled and non-skilled home health aides, because it really provides us a good overview. We screen all our patients for depression, but anxiety really struck me that this is what we need to focus on right now. Thanks again, Mia.
Absolutely. And the resource links to the fuller information about those screeners are there. If anyone wants more information about those screeners or other screeners, let me know, and I will be, or let whoever your connection from Superior Health is, let them know, and they can get word to me, and I will definitely share more information. I'm seeing a few things here. So we have residents are bored and upset because they want to go shopping. They're tired of not being able to eat together, sit together, not seeing their families. These are challenges, right? Because those are some of the things that would normally bring joy. And it's important in this time to find joy. I have a group of friends that we've been getting together on Zoom meetings periodically, and we just decided that we might try to do one of those like paint nights together on Zoom. So something like that. I've been going to, probably more than I should, some Zoom shopping channel, when someone is like, they sell, I think it was just a Pampered Chef one that I went to. Instead of a Pampered Chef party, they had a Pampered Chef Zoom party, and we went. So really, it does require a little bit of flexible creativity, but I wonder if there's a way to set up some, shopping that isn't out in the world, unfortunately, right now, but might be satisfying that shopping urge, or, is there a way that we could eat together distantly? Because those things really are challenges. I know a lot of people are thinking now in terms of Thanksgiving and how might they get some Thanksgiving meals together where we're not allowed to be all together in the same room. What can we do to maybe stimulate that a little bit? So It looks like folks are interested in the recording and think it would be great to share more broadly throughout their organization. So the information is going to be made available. Oh yes, physical touch is just such a huge thing. I think lots of people are missing physical touch these days. Oh, and holding new grandbabies. Yes, yes.
I just wanted to quickly mention that the link to the slides were posted in the chat. I'm going to repost them one more time. Thank you guys. We will make sure we have those available at the beginning of the presentation next time. So thank you for that feedback, but here are the links to today's slides that you'll be able to use right away.
So I'd like to go back, this is Mary, just to the part about, you could utilize this within your organization. Something to think about is, and I'm sure going through many of your minds, is the fact, well, if I would do this for my staff who already have healthcare providers themselves, why would I do this? As you know, time is, a problem for many of us, I think for all of us and your staff. And so you're going to need someone to be able to have that extra access to mental health care. And so within your organizations, I think about, a nursing home. I was a nursing home social worker. And this would be something that would be an excellent way to utilize your social work staff within your agency, because perhaps your HR department doesn't have a clinician there. So remember, you do have your social work staff, and they are very supportive if needed.
And I think, one of the things as we're in this, it just feels like a crisis, right? We have staff turnover, we have staffing shortages, we have a shortage of supplies. There's so many crisis things that are calling our attention all the time. And I'm hearing in the chats really a recognition that residents are declining and staff are struggling. And so I wonder if it might, what I'm thinking a great outcome of sharing this with your organization might even be just an established time to start the conversation, to brainstorm. I know that lots of you are doing tons of really innovative and creative things. And I also know that, when you're just making sure that all the to-dos, all the urgent to-dos get done every day, it's hard to have that space. So I wonder, how could you have a, suggestion box kind of thing, which isn't one for complaining, but just a suggestion box where you encourage people to give you their creative ideas, or, some sort of brief conversation with your staff to say, hey, we're looking for ways, we're open to new ideas. Everybody bring any of their ideas to us, and we'll try and figure out if there's a way to make it work. Maybe it's giving a picture, half of the picture to the family to color, half of the picture to the resident to color, and then you put it together. All of those kinds of small things that seem a little cheesy, but some are going to land just right for people and be meaningful. So what is it, and how do we get those ideas really flowing within our organization? How do we get this to be a focus? Because everything else feels like it's on fire, right, all the time. And so how do we just raise this up as a priority as well? And I'm hearing some great ideas, and I am confident that there's just a wealth of creativity in all of your staff to help address this if we just put our focus there.
Thank you so much, Mia. We'll kind of give everyone a couple more seconds if you need to or want to make any more comments in the chat or unmute yourself, and then we will close the call. So we'll just give everyone a couple more seconds for any last comments or questions. Oh, there's one that just got added. So could there be a tip list to send to families / close friends of patients of things they could still do to ease things for the patient? For example, my parents are still at home, but I could tell they were down. So I sent them each a care package with puzzles and little activities to keep them busy. I've also done some coffee hour via Zoom.
I love that. We can look at developing a starter tip list, but I also think, you know, the beautiful thing is that you guys know your patients and your residents best. And so you will know what kinds of things would be most helpful for them. I think having that kind of tip list to send to families is great because families are sitting at home feeling helpless as well. So giving them something that they can do, I think would also be, it would be a benefit on both ends of that connection.
Yeah, I think we've had quite a few, like since the beginning of having all of these calls, a lot of great ideas posted in our chat from participants. So maybe it's something we can kind of look back on and try to compile. Well, with that, we do want to thank Mia for joining us today and providing all of this great information. As I mentioned, the link to the slides is within the chat right now. I'm also going to post the link to our evaluation, if you wouldn't mind taking that and letting us know how we can improve our future calls. We'd really appreciate it. Like I said, already knowing that you guys want to have those linked to the slides right at the beginning, we'll make sure we make that change for next time. And with that, that concludes today's presentation. We hope you'll join us on October 22nd for our next COVID-19 all settings call. Thank you everyone for joining us.